this is just one example of a patient, so 48-year-old Hispanic female. So I practice at UC Davis in Northern California, and we have a lot of patients who come from all over the world. We're a specialty practice. We get a lot of referrals, but we see a lot of patients from Mexico as well because we're in California. So she actually had RK done in Mexico, and she was saying that her vision was blurry at all distances. She is relatively young. I'm continuously surprised how these patients are so young who have had RK. And of course, highly irregular astigmatism, no big surprise. We also, very important to evaluate the ocular surface prior to fitting lenses. So she did have, and she much better controlled now, but meibomian gland dysfunction and dry eye, so doing a complete workup there. She wore corneal lenses, corneal gas permeable lenses, and here you can see her prescription. So she, at this time, was unable from a different provider to be fit with corneal lenses, and she came to me and we talked about different technologies. So here you can see her bisphere elevation maps, and kind of short and sweet case here, but she was fit with lenses in a reverse geometry design. She is able to wear the lenses all day long very, very successfully, and reports even better vision and improved comfort with this lens design. So she had pretty significant dry eyes. Now she's able to wear the lenses all day. The one thing that she is developing of interest, which I feel like everyone is developing right now, is cataracts. Everyone is coming in with cataracts. And so we're talking about that and her scleral lenses and how we're going to change that after cataract surgery. Fortunately, we don't have to change the scleral lens a lot, but the power we do have to change. So just one case of many, many, but very happy with her scleral lens design.
31-year-old patient. She's a Hispanic female. She's from a different part of Mexico. And she got LASIK surgery done in 2012 when she was 21 years old. Unfortunately, developed post-LASIK ectasia in her right eye and developed also dry eye in both eyes, more so in the right. In the same city, they placed an intrastromal corneal ring in the inferior part of the cornea, which unfortunately she faced then a couple months later extrusion of the ring, so it had to be surgically removed. They did cross-linking on that eye and then also on the left eye, which they were following up closely with topographies and started seeing some changes, so they went ahead and cross-linked. At that point, she moved to our city in Monterrey, Mexico, and was referred to us. And she had a visual acuity of 20/200 in her right eye, the one that had the rings put in and taken out, and 20/40 in the left eye, and some discomfort due to dry eye. We got her in the office. We talked to her about sclerals. Everywhere is still an expensive technology, and in Mexico more so. So we went ahead and fitted her more problematic eye, which in this case was the right eye. We had to do 3 remakes to get a good lens, and were able to get her happy. This was back in 2016, and she was 20/20, and got at least 8 hours of comfortable wearing time. Sometimes, took the lens out in between in lunchtime, so she could extend for some more hours. So this is an example of a patient that was already happy, but now that we got to make lenses for her using this new ESP technology, as you will see, she was way more happy. So this is actually a couple months ago that we got the ESP in our office. So we scanned both of her eyes, just because we were also kind of practicing. And she was only going to do it for her right eye. You can see that in the right eye, this is the bisphere elevation map that the ESP gives you. You see a fairly spherical scleral shape. And that's why we have been able to get her happy with spherical haptics 5-6 years ago. But on the left side, and I was a little bit surprised, then you have a more complicated scleral shape, more complicated conjunctival situation as well, with some big elevations, especially at 3 p.m. and also at 4 p.m. So when I saw that, because when I started showing her the ESP and the images, she said, I want to get it now in both eyes. So a little bit what Dr. Morrison was telling us, when they see the images and you get the 3D scan in the TV and everything, they get really excited as well. So I said, okay, let's do both eyes. We'll talk first about the right eye. This is basically what we did is we took the shot with the ESP. We sent it in. This is a lens made with Aculens. We sent it to the Aculens lab. We sent them the previous lens parameters with the previous lens over refraction. We didn't even put a new lens on top of the eye, and told them, you know, let's see what you can do with this. We were kind of testing out the technology, and they sent us this lens, which, as you can see, fits really nicely. The eye looks white. You have nice coverage on the OCT images. You get this fluorescent pattern that the ESP also gives you, where basically you see, in this case, that there's coverage all around. So she was instantly really happy with that, and we'll discuss some of the results a little bit later. On the left eye, which was the first time we put scleral on that eye, and it was a more complicated eye in terms of the scleral topography. As you see in this image in the bottom left, the lens haptic has an elevation. This is a free-form lens, and that's actually about 300 microns elevation. It was a big conjunctival elevation we had to get over. And this was, we didn't have to measure anything. It was basically done off the scan. And again, you see a white eye in happy patient, you know, happy eye. So basically, this is on the top. This was her previous situation. She was a happy patient with 20/20 who got about 8 hours of comfortable wearing time in her right eye, and that took us 3 remakes to achieve back in 2016. Now, in 2021 it was, we did both lenses that we described. Both were done on the first order. She's getting 13 hours of wearing time. And she's very happy because now she resolved the dry eye issue in her left eye as well. Plus, she was also, one of the things she wanted to is to not have an asymmetrical lid opening, so she was also very happy with that. So that was her first patient. Obviously, they don't all go that way, but we're really excited for her, and she's now in love with both of her sclerals.
Well,
and you.
And you, yeah.
This is actually used with permission. This is my actual patient. She's one of our staff, and she is excited to be famous in Vegas today. And she presented as a new patient, myopic, a little bit of astigmatism. Her biggest issue is contact lens dropout. So we talk about ESP use for scleral lens patients, orthoK myopia control. We also have other applications outside of myopia control for orthoK. So in this case, it's a dry eye case. You can see her refraction there. So not a particularly out of the ordinary orthoK fit, although on the left eye, for some, it may be getting, you're getting astigmatism and kind of moderate myopia. So we took measurements. I threw this in here just to show you for the case for completion to include her lid scan. So she's struggled. She suffers, and she can't wear her soft contacts during the day. With the Eaglet, we're now able to utilize it for orthoK. And so what you're looking at here is our map of Brooke, showing her elevation map. And that's the data that we like to use when designing orthoK lenses. Here is an example of our corneal elevation map of the same patient. And her baseline map. This is how we use the software to empirically predict and design a CRT orthoK lens. So in this field, we can select, in this case, CooperVision, Paragon CRT, and the software will predict our starting lens, similar to like a slide rule, but it's completely done independently through the Eaglet folks and all the algorithms that they've expanded on over the past 12 plus months, and to create the data that we need for our orthoK lens. Now, this does connect with Direct Connect that Dr. Wolf had talked about, and to make the order process really smooth, everything's digital, so it speeds things up a lot in the practice. There's a record of everything that you're doing. Things go straight to the manufacturer for the order, if you choose to. And this is the lens on the first lens, so as we can see, this is an absolute beautiful lens. I did not fabricate this. This was Brooke's first lens based on her ESP. And the lens looked so great that I decided to take some artsy photos of it, and away she went. So we can look at difference display maps now with the ESP as well. So for orthoK fitters, we know we need to look at our power change, but also tangential curvature as a primary measure of the centration of that lens when the patient sleeps. All very doable and very effective at this point with the software. And then here's a little closer up here. And then here's our axial and tangential curvature maps as well, all generated from the ESP.
is basically a typical orthoK candidate, kind of a moderate myope, especially for 9 years old, so concerning. So we implemented some myopia management with orthoK. She is about a minus 250 on the right eye. At about a month follow-up, these are her comparison maps, or her difference maps. You can see the vision's not quite as good on the right eye. If you look in your power profile map right there, this is going to show you how much power change you've had. So 2 diopters of power change, that's going to leave us about half a diopter of the refraction. It's a 250. You basically just showing off the precision of the instrument. Very well predicted 2 diopters of change there. Okay. On the left eye, this was about a 2 diopter, about a 175 to 2 diopter myope, and same thing. If you look at the precision of the power profile, predicted it very nicely.